Thank you. Good morning, everyone. We're going to go ahead and get started. It's 10 o'clock. As people file in, if they do, we'll just let them do that. But we're going to get started this morning. So welcome to this Allergies Unmasked. I'm very excited that you're all here and to share this information with you. I've actually learned a lot doing the research for this talk. I was telling the ladies in the back, it's funny because as a team, when we were talking about putting this talk on, figuring out which doctor was going to do the talk, I volunteered, but Dr. Cameron's asked me if I had allergies, and I said no. And then this last week, I've been attacked with pollen, and I've never experienced it before. So it gave me some good experience to put behind this talk, right? So if I sound a little congested and snotty, I apologize. But I am much better than I was just a little bit ago. So Allergies Unmasked. We're going to talk about what allergies are, understanding what they are. We feel them. We feel what they're like. But understanding what they are, the science behind them, meaning what is happening in our body at a physiological level, the root cause of allergies, holistic strategies to support our body, and then actionable steps that we can take to help our body and support our body as we are, if we are affected with allergies. Allergies are often seen as an annoyance, right? I experienced that this week. A lot of us in this room, we've seen patients in the last month or so talking about allergies. They're sneezing, itching, congestion, avoidance of foods, but they're a signal, like our body's avoidance to foods. But allergies, whether it's from food, pollen, dust, dander, it's a signal. It's a signal that our body is out of balance and that it needs support if we have a hyper reaction to allergies. So today we're going to look beyond the surface of the symptoms and explore allergies through a different lens, ones that honors the innate intelligence of the body, meaning having confidence in our body that it's doing what it needs to do in the moment, but that it can adapt and recover quickly. We'll dive into how lifestyle, environment, stress, and our nervous system function can play all a role in our allergic responses, okay? So we're also going to look at natural holistic approaches and how we can bring the body back to harmony, because healing is more important than the symptom management. And the symptoms of allergies are annoying. So it is an annoyance. It is frustrating. But as we walk through this talk, we're going to see how our body's doing what it needs to do to recover quickly. Okay, so what are allergies? Allergies are, when it's prolonged, it's an overreaction of the immune system to substances that are normally harmless, such as pollen, pet dander, dust, mites, certain foods, and insect stings. So as biological beings, when we come into contact, especially with the environment that we are born in, that we've lived in for a long time, when we have an overreaction to those things, it's a hyperreaction of our immune system. So there's a part of our immune system that is not functioning well. Now, in people with allergies, the immune system identifies the allergen as a threat and triggers a defensive response. Now, that word mistakenly is highlighted there because when I initially wrote this up, I put that word in there, but it's not a mistake. Our body's not mistakenly identifying the allergen. Our body's doing what it needs to do and identifies the allergen. It's the response to that allergen that our immune system is not able to cooperate with, okay? So that part of our immune system is being downregulated for some reason, and we're going to talk about that. All right, so a little bit of statistics here. I was just talking to the ladies in the back about this. According to Asthma and Allergy Foundation, Tulsa is number 4 in the country, okay, for allergies. Oklahoma City is number 3 in the country. So 2 cities in Oklahoma are in the top 5. Wichita, Kansas is number 2. New Orleans, Louisiana is number 1. So 1 in 3 adults suffer from allergies, some way, shape, or form, and 1 in 4 children suffer from allergies, one way, shape, or form. The factors taken into consideration when ranking these states is how many over-the-counter allergy medications are purchased, pollen count in the area, and how many board-certified allergists are working in the area. Okay, so It is big business, right? So allergies have been around for a long time, and they're definitely not a new problem. But the prevalence is increasing and it has continued to over the last 50 years. So allergies is continuing to go up. And what we are seeing is a resignation. It's a resignation that is accepting of allergies, that there's something that is a part of life, but in reality, they should be viewed as red flags if it's a hyperreaction. So essentially, we should be getting over an allergy contact to an allergy within about 3 or 4 days. You know, our body is like going to dump mucus, going to protect the airways and stuff from that pollen getting into the lungs and whatnot, dump it out, and then 3 or 4 days. But what we're seeing is histamine dumping to environmental particles. And histamine dumping is the mucus, the coughing, the itchy eyes, the itchy throat, the watery eyes. That's all part or result of the histamine dumping in our body. When we have prolonged histamine dumping, it's a sign that our system is compromised and that there is an underlying cause. So here's the type of allergies: food intolerance, food allergies, food sensitivities, and seasonal allergies, which we're going to talk about each one briefly here soon. Food intolerance is the body's inability to break down a food molecule. So that first one, food intolerance, that is something that is our body's inability to break down a food molecule. And what's the most common one? Lactose intolerance. Yes, lactose intolerance. Of the 4 types, food intolerance is the only one that does not involve the immune system. It's the only one that is part of genes that we tend to have. So if you're lactose intolerant, it's pretty much not got to do with the immune system. It's what you have as far as your genetic material. Now, food allergies, food sensitivities, seasonal allergies all involve the immune system. So it's a direct play with our immune system. And each of these activates specific antibodies. So food allergies, sensitivities, and environmental allergens, they encounter and activate specific antibodies in our body within the immune system, and then therefore kick off the inflammatory process when our immune system is not where it needs to be. So quickly, antibodies, if you're not aware, they are the proteins that help our immune system to identify and destroy foreign invaders. They recognize the non-self particles. So that red ball with the spikes, that's an invader. And all those Y-shaped proteins, those are all antibodies coming in to attach to it, release a chemical telling the body, like, come get this, come break it down, destroy it, and get rid of it. That's what our antibodies are for. Antibodies are proteins used by our immune system, and their job is to fight off the foreign invaders such as bacteria and viruses. They're supposed to recognize and bind to these invaders. They're called antigens, and neutralize them. The problem is that the body is viewing them as harmful and not able to have a reaction to calm down the immune system with attacking the particles that are not harmful to ourselves. When the body starts down that path, there has already been an underlying problem for a long time. So when we have a hyperreaction, there's an underlying problem for a long time. A lot of times symptoms are not surface or at the surface, but is a manifestation, a red flag of something else underlying happening for a very long time. So first on this list is seasonal allergies, which is a big one, and we've all been dealing with it. Seasonal allergies is cooped up with food allergies. Now, what we have here, yeah. Food and seasonal allergies activate the IgE antibody. So there's 3 antibodies, the other 2 I'm going to talk about in a minute. And this is just for your knowledge. If you ever see it in your blood work, you're going to know exactly what it means after today. So it is an immediate response. It's a classic example of a peanut allergy. So it's immediate. The body recognizes it and starts going into action. It's present in childhood and persists through adulthood. The IgE antibody is the immune system is at play. They are the classic allergy antibody. Okay, so primarily, oh, sorry, let me go back. Primary antibody involved in true allergies, and it triggers immediate hypersensitivity reaction. It activates mast cells, which in basophils, which are the cells that are at play when we have allergies or infection, and it releases the histamine symptoms. Now, the best way to test for this is through a blood panel or a prick test. The blood panel will show the antibodies. The prick test shows the result of the reaction to that allergen. The prick test consists of putting a minute amount of allergens. So I used to work in dermatology, and I used to do this test all the time. And we would draw on the back, just like this picture, all the numbers. And then you take, who's been through this test? A couple people. Okay, so you've experienced. So the allergens are on the tape or whatever they're putting on there, and then you light up if you have an allergic response to this. Now, if a hive or welt shows up, it's a positive test. Now, the issue with this test is that the allergen that they're putting on the skin is made in a lab. So it's the synthetic version of what's out there in the environment. So if you show up as a positive to this allergen, there is a possibility that the body's showing an allergic response to the synthetic portion of the allergen. So maybe not necessarily allergic or to that degree to the environmental allergen. So that's the problem with this test. It's industrial synthetic version of the environment antigen, making it hard to conclude if it's actually a positive, because there's a possibility the immune system is responding to the synthetic. The gold standard test is a double-blind, placebo-controlled oral food challenge or to the allergen. Now, this is non-invasive. You get true results, but it's time-consuming. And practitioners and doctors don't really see it as practical because it's very long. Yes, yes. I mean, for example, my son, one time, he was playing outside. This is when we lived in California. And I think he was running from our dog. And he jumped over a wall and landed into some bushes. He comes to the front door and he's freaking out and he's completely covered head to toe in hives. And, I just made sure his respiratory response was good. He wasn't swelling up. He just had the hives. He was allergic to that bush. He was just exposed to the bush. He had an allergic reaction to the bush. It wasn't prolonged, but this is similar. Like you're exposing yourself or your child to these allergens, and it's going to be a true response. And then that way you'll be able to know exactly what they are referred or allergic to. So neither the parents, the patient, or the allergist know when the patient is eating the suspected food allergen or the placebo, okay? So no one knows, there's no pre-thinking or pre-thought of what they're eating. They have no idea. And this is done by administering escalating doses of the suspected food allergen and a placebo, usually on separate days or within a time gap to observe for any allergic reaction. They start with low doses and then escalate up to higher doses. The patient is monitored, and of course, if there's a severe reaction, they would come in and help with that. But it is the best gold standard way to figure out what is going on, what they're allergic to, and to be able to help their body with that allergen, okay? Now we move into a food sensitivity. And this is a food and immune reaction, okay? It starts early in life and develops over time. So in the early years of life, our thymic gland, which is behind our sternum, is processing everything that the baby is going to come into contact with. And that's usually about 1 year old, they start, or actually 6 months old, they start crawling around. 1 year old, they start walking around, and everything they touch goes where? In their mouth. And we're going to talk about that in a minute, but the thymic gland is learning every single thing that baby is coming in contact with. It's learning to see what self and non-self is. Now, in food sensitivities, there's food versus actual threats. The recent finds is that adults and children are losing tolerance to foods over this time. There's just a lot to play into here. It's not just the foods. It's how our foods are processed. It's what's being sprayed on our foods. And that's why this intolerance is going up. So it's not the food itself, but it is going up. Now, in food sensitivities, the body uses IgG and IgA. So the immediate allergic response was IgE, and then we have IgA and IgG antibodies. So IgA is in the mucous membranes of our nose, our lungs, our gut. It helps prevent us from penetrating the body through these surfaces. So that antibody, when we suck in a pollen, is coming up with the mucus into our lining our throat and our face. It's especially important in gut health and oral tolerance to foods. It's overreactive in cases of mucosal irritation and underreactive in those with gut barrier dysfunction, also known as leaky gut. So it's a very important antibody to have because of the job that it has to line our mucous membranes and develop mucus, but it can be overreactive and not doing what its job for us. Now, the IgG is a delayed responder. It's not typically involved in classical allergy. It may respond to ongoing or chronic exposure to foods or environmental triggers. It plays a role in delayed hypersensitivity reactions hours or days later. So, for example, if I eat pasta, I end up, and I never used to when I was younger, but now I will bloat. That is a IgG delayed response. It's my gut that I have been on a journey of healing for a while is not happy. It has issues with leakiness, and then it bloats. That's an IgG delayed responder. If you eat processed food or fast food and you don't do it quite often, you'll notice maybe hours later bloating or mucus production, that type of thing in these. So it may signal low-grade inflammation rather than an allergic reaction. So then if you don't know what this low-grade inflammation is, you're not really relating it to the food that you're eating. You just notice that you have a runny nose. Maybe relate it to your air conditioning, stuff like that. Now, when dealing with the environmentally induced immune problem, there are stages, okay? So there is a pre-autoimmune stage. So this is with our food sensitivities. And this leads to advanced stages of actual autoimmunity. So when I was talking about in the beginning, like underlying issues, it can be a silent problem progressing. I just have allergies, or I have, some bowel issues, et cetera, and then this can be compounded effect into greater or more intense diseases as we get older, a lot of times autoimmune conditions, which we're going to talk about soon. When multiple areas of our body are not functioning properly, it is a recipe for a pre-autoimmune condition. The body is in such a stage that the environment is essentially driving the immune system into a chronic inflammation imbalanced state. So that can be chronic allergies throughout all seasons. It could be bowel issues, constipation or diarrhea. It could be constant sinus infections. All of these are signs and red flags of these issues. And food is the biggest part of our environment that we're exposed to day in and day out, multiple times a day. So when dealing with the environment, induced immune problems, these stages are red flags. Now, we're going to talk about in a minute the removal and repair, but with chronic sinus infections, does anybody have chronic sinus infections in here? Couple people. In the research that I had, it said to look to the food sensitivities. And a lot of this information that we're going to share as far as it goes to like Hashimoto's, food sensitivities, celiac, gluten, a lot of this is stuff that you're going to work with over time for your body to get healthier. Now, with allergies, like in allergy season in Oklahoma we're in right now, when we talk about the things to do for your body, are you never going to have a response again if you say you do everything you need to do to clean up your gut? No, you absolutely will. You absolutely will. It's priming your body to be able to deal with these allergens and the food sensitivities to be able to adapt and overcome in a short amount of time. That way you're setting yourself up for the biggest amount of success in health over time, and not allowing it to escalate into what could be an autoimmune condition. Now, with all of this, this is where it starts. It starts in the thymus gland. So you see the picture of the thymus gland in the child versus the adult. The thymus gland in the child on your left here is huge. It's huge. And as we grow older, it shrinks up to that small gland behind our sternum. So infancy is where this will start. This is all started in infancy. In the thymus gland, when kids are going around and touching everything and putting everything in their mouth, they're developing T cells. T cells are the big fighters in our immune system, okay? Branching off the T cells, there's a branch called T regulatory cells, okay? So an invader comes into your body. T cells come in, they're like, this is a foreigner, let's kill it, okay? The antibodies come in. It ends up being not a bacteria, not a virus, not a parasite. T regulatory cells come in and say, this isn't harmful. Let's downregulate the immune system so it doesn't have to go into full inflammation mode. When you have allergies that are out of control, like my neighbor, she's been dealing with the pollen stuff for 3-4 weeks. Now she's older. I think she's in her 70s or 80s, so it might take her a little more time. But we shouldn't have an exponential amount of time that we're having to deal with this. When you have these inflammatory responses that are not going away, your Treg cells are being downregulated and are not able to be active in the body, okay? But this all starts when we're young, okay? This all starts when we're toddlers. That thymus's job is to train and mature the T cells, which are vital for the immune system in order to fight and recover from infection. The thymus gland is the most active during childhood. It is programmed to learn all it can early. It is the training ground for T cells. The immune soldiers that learn to recognize friend from foe. The T cell family we have, Treg cells, and their job is to check the immune system, okay? They do this by telling, this is harmless, don't overreact, or this is dangerous, take action, preventing us from attacking our own tissues, which is autoimmunity. So the T regulatory cells are vital in our autoimmune deference, not getting there. This is why exposure to all the environment as babies and toddlers is vital in order to have a strong immune system. The first 3 years, the thymus gland is responsible for programming the T cells, the Treg cells. And if the T regulatory cells are not programmed in a correct fashion, you end up with allergies and the things in the environment that you shouldn't have allergies to. The basis of childhood allergies is improper programming of those cells, which comes into improper programming of our immune system and improper programming of our gut bile, okay? So this is all from when we're little. So kids need to be exposed to the germs. They need to be exposed to the bacteria. They need to play in the dirt. They need to touch grass. They don't need to having the antibacterial stuff on them every 5 minutes. That's how my stepmom was, is counterproductive to that, right? So my half brother, we grew up in separate homes, but I ended up living in my dad's home when I was 15. And he was raised in a sterile environment. And so there is the too clean. There is the constant antibacterial raising part. And that also is catastrophic to the immune system and getting into these. He was on allergy meds as a small kid, constantly washing his hands, constantly going to the doctor, and has a ton of allergies. Now, my granddaughter, she's 1, and she was at my house recently, and she got into the dog water. She got into the dog food. She's outside putting rocks in her mouth. She's doing everything. I was on the phone with my daughter the other day, and they're outside, and they have one of those little plastic slides in the backyard. And she turns the phone to her because we're on FaceTime, and Roxy's over there licking the side of the slide. This is all, yeah. This is, yeah. It is priming her body to be very strong. And that thymus gland is learning from every single thing she's doing. It's very important for our kids to play outside, be in the dirt, and touch the gross things. Dr. Callahan was talking about, when we were talking about this talk, how his son was at a parade or something and had a sucker. And they were walking down the sidewalk. His son dropped the sucker, picked it up, and put it in his mouth. And there was a lady behind them was like, "Oh my God, it dropped that on the floor. Get it out of his mouth." And Dr. Callahan was like, honestly, what the sucker is made of is probably more harmful than what got on the sucker. So, yes, you just pick it up real quick. Oops, I told on him. 80-20, 80%. But that's why it's so important for our kids to really get out and touch everything. I mean, they play in their own poop, gross cleanup, but it's programming, right? So everything is programming into that thymus gland, and it's vital for as we get older. So I'm gonna play this video for you. This is about a family, raises their kids on a farm. Let me make sure the volume's up here. Hopefully that's not too loud.
From colds and flu, and the other half seem just fine, immune. Well, it turns out there's a lot of research showing the best medicine for modern health could be as close as the barn. ABC's Sharon Alfonte's been digging into the proof.
The McDonald family had a farm, and on that farm they had not one, not two, but 9 children. 8 boys, 1 brave girl, each the picture of health.
Why do you think your kids are so healthy?
Good genes.
Good genes help, but it turns out so do these chickens and even the slaughtering pigs. It might seem counterintuitive to a country obsessed with antibacterial lotion, but those animals could be one of the reasons these kids are so healthy.
Do your parents ever say to you, "Don't touch that, it's dirty"?
Yes, only if it's really dirty.
One study found families on farms are almost half as likely to have asthma and nearly 4 times less likely to have hay fever. And researchers say animals help kids grow antibodies to fight infections better. I got up close and personal with Rosie.
How much milk do you go through with 9 kids?
Probably 2 gallons a day.
2 gallons a day?
Yeah.
Oh, you better get another cow.
But you don't need a pet cow. Exposure to a family cat means a baby will have 6% fewer colds, coughs, ear infections. Babies raised around dogs will have 31% fewer infections. Researchers believe pets may help children's immune systems mature faster. And on the farm, the McDonald's make their own music too, improving memory, immunity, and even muscle tone, keeping the family and their health in perfect harmony. Sharon Alfonte, ABC News, Romulus, New York.
All right. So, I mean, not all of us can live on farms and have that kind of life, or some of us don't or shouldn't or can't have pets. But what this family is doing is they're outside. Their kids have chores outside. They're exposed to dander. They're exposed to the soil. They're exposed to the plants, the sun, and everything in the air. And then they eat whole foods, most likely. Okay, so they're getting the 5 essentials. Okay, most everybody is a practice member here. What are the 5 essentials? Does anybody know that we talk about in the?
Mindset, exercise, or oxygen.
Yep.
Chiropractic adjustment, the nutrition, and detoxification.
Beautiful. She needs a gift for that. Years, and she comes to every single workshop that we have here. But this family is living the 5 essentials. These 5 essentials we talk about here in the clinic, especially at the workshops that we have, are the very foundation of health, the very foundation. I mean, anyone who puts these into practice in their life sees exponential health and longevity in their life. And this is basically what's going on this farm, okay? Now, well, I don't know if they're getting chiropractic adjustments, but I hope they are. But that would complete the 5 essentials there. Yeah. Hmm? Mindset, chiropractic, exercise and oxygen, detoxification, and nutrition. Thank you. Yes. So we're going to talk about a couple of those as it pertains to our allergies, but this is what is strengthening our immune system. Now, this is so cool. I want to talk about this study that I found on a publication here. And it was done in Finland. Okay, both of these playgrounds is the same playground. It's what they did different to it. That was really cool. So it was in Finland. It was done in the inner city daycares. So this is a daycare in densely populated and urbanized areas. And in a number of the daycare playgrounds, they created a mimicking of the forest floor. So the one on the green with the green ground, that's what they changed it to. They used peat moss, sticks, woods, blueberry plants, different types of bushes, Scotch pines, pine cones, and they tested the bacterial load of the forest floor on these playgrounds was a magnitude higher than like mineral soil and the bacterial community that was different between both types of playgrounds, okay? So there was a bacterial load. It's a healthy bacterial load on there. The results were so insane. I got so excited when I read this, so I had to put it into this. So outside of the kids being super excited about playing in the grass, this is what was reported by the teachers. The natural materials increased and diversified the children's physical activity in the daycare, so they were more active, and the way they played was different. So it wasn't the same as just running on the gravel to the swing, running on the gravel to the teeter-totter, okay? It was diversified in the daycare yards. The sod and the forest floor mat enabled activities such as rolling around, creeping, crawling, doing somersaults, doing cartwheels, and other physical movements. You can't do that on gravel or the wood chips or the rubber used tire bits that are insanely toxic for our kids. They were doing physical movements which were not favored activities in the former yard covered with the gravel. The natural materials increased and diversified the children's activity in the daycare yards. The sod and forest floor mat enabled activities. Oh, I read that, sorry. The greenery also increased opportunities to resting and relaxing in the yard. So they got to lie down and sit in the grass and on the soft ground and look up at the sky and listen to sounds. The green yard enabled social activities organized by daycare employees, such as reading stories and having a picnic. Children engaged in sensory-based play, especially teacher-led activities. They were in contact with natural materials, and they would test it through sense of touch, smelling, tasting the vegetables because they grew some of the vegetables or the forest plants. And overall, the employees and parents felt that the modified yards were pleasant as they looked and smelled good. The greening of the yards had positive impact on both the children's and adults' mood and energy and motivation in the daycare centers. So some daycare employees noticed that when the children spent active, inspiring time outdoors, they had good appetite at lunchtime, they slept more deeply during their naps, and this was considered to further the benefit of children's well-being and learning ability. After 2 months, the kids that played in the daycares with that mimicked forest floor had more resilient and diverse skin and gut microbiome. So they tested them. And they had more resilient skin and gut microbiome, and their inflammatory markers were downregulated. We are healthier when we are outside and playing in the dirt. It literally balances our bugs. We have good bugs and we have the bad bugs, and it balances bounce those, and it bounces the microbiome in our skin or on our skin or in our gut. Isn't that cool? Like the experience of play on that forest floor playground versus the gravel. And when I really started to think about it, when you watch kids play on those hard surfaces, it's nothing like that sensory. They don't get that sensory play that these kids got on these forest ground. So it's amazing. All this to say that as a child with the thymus and as a child playing outside and everything that they're exposed to, we have what we call a theoretical bucket that our body is able to withstand. The buckets talk about is your immune system, your central nervous system, all our systems, our whole body, and everything that we put into that bucket from day one. And as we go older, that bucket fills up. And how it fills up is a manifestation of our body, and in this case today, our allergies and our autoimmunities, okay? We should view our immune system as a bucket and what it's being filled with and what it's not being filled with. Our body is a very capable and intelligent entity. It can learn and regulate well. It will learn to be down-regulated to clean, multiple antibiotic doses, allergy medications, processed foods, poor mental health, unmanageable amounts of stress, lack of movement. All of that is going to go into that dirty water bucket. Let me just talk about stress for a minute. When we talk about stress, a lot of times I will hear people say, decreasing stress or trying to avoid stress. Stress is a part of life. It's about how we manage the stress, how we process that stress. That will determine how our buckets are filled. Stress is a culprit for disease. It's a culprit for, and we'll talk about it in a minute, for gut leakiness and our mental health. So our mental state is vital for all of this. But what we are filling our bucket with on a consistent basis is how it determines our health, longevity, and our immune system to be. So I put the 5 essentials here. And here's the thing. When we have kids, and when they come into this world, what are they exposed to right away? And a lot of places are getting better where they're just taking the baby and put it on the skin, but there's a lot of places that are not. So when a baby is born, it's taken out into the sterile room. They are covered with the, oh no, I forgot the name of it. It's the mushy stuff on the skin. That is antibacterial, antifungal. Do you remember what it's called? No, they come. Yeah. Oh. Something like that. Man, it's going to come to me in a minute. Yes. I think Deborah's looking it up for me. Vinix, yes. So it's antibacterial, antiviral, it's antifungal, antiparasite. My daughter kept it on her kid for the first 2 weeks of life. But the kid comes out and it's taken, and it's going through APGAR scores, right? So they're weighing it, measuring it, seeing how it looks. And the cord is already cut, and then wiping it off. And then maybe taking it to mom. Oh, sorry, the clindamycin on the eyes, vitamin K shot. So this is all the first few minutes into the world. That's already pouring into the bucket. That's why it's so important for skin-to-skin contact. The baby needs exposed to be mom's skin, the bacteria on mom's skin, hearing her heart, hearing her voice. That is pouring into the bucket. And as we grow older, with our immune system, there's a lot of things as we are growing through our milestones, our well baby checks, and the stuff that's getting pushed into the system, whether you decide to or not, and there's never any judgment there, but that is compromising the immune system. I mean, that's just science, okay? So if there is vaccinations and they're starting to put more and more into the schedule, it compromises the immune system. Kids should have maybe the first 2 years of life without that, but that's just my opinion. But that essentially is compromising the immune system. It is taking a step in and saying, you can just wait there. I know what to do, when we're fully capable and have been innately made in God's image to be able to handle all that we encounter. So the bucket is vital as we are young. Early life influences help educate and train our immune system to learn what warrants a reaction, like a parasite, for example, what doesn't warrant a reaction. What is emerging in some of the factors that are hindering our immune system is the development now are things like more C-sections than vaginal deliveries. 32% of women receive C-sections in the US. And according to the World Health Organization, they recommend only 10 to 15% of the women that give birth have C-sections. So there are numerous ways for why vaginal delivery should be the absolute preferred way. And I am talking about this because it is exactly what that bucket is going to be filled with and as how we come into this world, okay? Now, the reason why it's so important for us for vaginal delivery, if at all possible, it's not always possible, is because of the seeding of the microbiome as the baby is coming out. So it's exposed to fluids from the mom as it's coming through the birth canal, and that all goes into the mouth and into the gut, and right away the immune system starts working. Okay, so that with C-sections, though, they started taking those fluids and then wiping them across the baby's face to seed them to help them with that. So that is pretty cool. The concern is the amount of C-sections that are done in the US out of convenience for the practitioner, okay? Yeah, and convenience. I had a patient ask me once, because her OB-GYN was suggesting a C-section, and she has no complications in her pregnancy. There's no red flags as to why she should have a C-section. And I just told her, have you had C-sections before? Because she had 3 other kids. She said, no. Listen to your body. If you feel competent and being able to do it, move forward with that. And she was very grateful that she did, and she didn't have a C-section. And more so than women, it's also, for some reason, minority women have more C-sections than the rest of the population. So it's very interesting. Like, one day I'll dig into that, but C-section rates are just too high. They don't need to be this high. And the US is one of the highest ones in the world. Yeah. Antibiotics are another issue within the US. Nearly 94% of US children have received at least one antibiotic prescription by age 5. Now, a lot of times when I was doing my research, this isn't even my own words, specialists think that we are overprescribing antibiotics to appease parents. My child is sick. I want to see them get better. Here's a prescription for antibiotics. What are antibiotics specifically made to fight? Bacterial infections only, not viral infections. And if your kid has a fever, it's most likely fighting a viral infection. By age 5, US children have received over 8 antibiotics courses on average, which equates to 1.6 prescriptions per child per year in early childhood. Antibiotics, the reason I'm harping on this is that it demolishes the gut biome. And if you're 5 years old and your gut's already being messed up by antibiotics, that bucket's already getting dirty water, okay? It interferes with the immune system. It interferes with the thymus gland's ability to learn and grow strong, so that when we encounter the invader, again, it doesn't know how to take care of it. This is where deeper immune issues show up as adults. IBS, irritable bowel syndrome, small intestine bacterial overgrowth, small intestine yeast overgrowth, autoimmune issues, allergies, and then we're put on more medications that interfere with our body's ability to defend against those. So real quick here, in case anybody wants to know, formulas. These are clean formulas to give because the ones on the shelves at the grocery store, have high fructose corn syrup, and that's terrible for our kids. So this is a clean formula for our kids. Now, when we encounter allergens, this is the course basically we go through. Allergen avoidance, so staying inside when there's high pollen count. Go into oral antihistamines. going into intranasal corticosteroids, combination of corticosteroids, antihistamine spray. If that doesn't work, then you might be moved on to a antagonist, which is just blocking certain proteins from connecting and doing. It's because our immune system's overreactive, so they're trying to down-regulate. And then if that doesn't work and it escalates, we might be on to allergen immunotherapy. So this is all medication after medication, after medication, after medication. We end up chasing the symptoms here and taking medications long-term, but there's always a trade-off with medications, even allergy medications. I don't think people understand like the trade-off that would be with these as well. So what are some of the side effects of our allergy medications? Benadryl. Benadryl is one that has increased risk of dementia if taken long-term. It blocks acetylcholine function in the brain and the nervous system. Acetylcholine is crucial for learning and memory. And it's a sedative hypnotic and is used as a non-benzodiazepine sedative. So I don't know, do people still give that to their kids? When I was younger with my young kids, I had friends who gave Benadryl to their kids to make them go to sleep. Yeah. This is not a good one. Zyrtec, which is common. Hello.
Morning. Sorry, I'm like.
It's okay.
Is it has red dye in it?
Yes. Yes.
So my daughter-in-law gave it to her son because he had gotten into a bee sting and then the red dye, he had a reaction from that.
The red dye?
So, yeah, so it was like, no.
Yeah. Yeah, I don't know. I don't know why they need to make it pink. It's prettier, I guess. Zyrtec has sedative qualities, not heavily metabolized by the liver, and can have a rebound effect, meaning when you go off the Zyrtec, you get the symptoms back again. It's just covering it up and down-regulating. Allegra, eliminated mainly through the kidney, and it can cause kidney congestion over time. The body becomes reliant on external histamine suppression rather than regulating it naturally, and it may interfere with the body's ability to recalibrate. So rebound symptoms when discontinuing care. So it's not able to balance out. It's just taking you back to where you started when you discontinue that medication. Oops. Nasal steroids such as Nasonex, Flonex. I mean, I used to take these back in the day because I wanted to breathe. But they decrease cortisol production, which leads to adrenal suppression, resulting in increased vulnerability to stress and illness. So it's down-regulating the immune system. Bone loss when taken long-term, such as osteopenia, porosis, especially in menopausal women because we're already at risk for that. When using both nasal and inhaled corticosteroids. And then steroid use in children can promote growth suppression and immune system suppression. So these all have long-term effects, and what we want to do is just get to the root cause and fix our body from that. And then we go into autoimmunity. Yeah. Yes.
I have a comment to make. I'm 26 years old and I've been a lifelong asthmatic. Since I was 5 years old, I've been on inhaled corticosteroids throughout acne.
Mm-hmm.
I started coming here about a year ago, spring of last year, and in the winter time, there's not been a winter in my life that I've not had an exacerbation, or if I've gone without my inhaler, had to make sure I had an inhaler or the nebulizer in hand. Last winter, my Joe was pregnant too. It was the first winter I went a couple months without my inhaled corticosteroid. I didn't have any exacerbations. I didn't have to rely on my inhaler. And that was like a miracle.
Yeah.
And, that was like the first time actually undergoing like regular chiropractic care. The air trapping in my lungs, the release of that due to the, adjustments have been miraculous. And so I'm really excited to go on the journey because I'm undergoing it once a week for a year from now.
Yeah.
And so I just kind of wanted to throw that in there because sure a lot of you have, throughout your lives been reliant on a lot of pulmonary or allergen related medication. I'm also a respiratory therapist, so I've worked with a lot of geriatric patients as well. And it's just mind blowing how the doctors are so quick to push these medications and not pay attention to our body's nervous system and our vertebrae, which is, I also had a newborn, and that's like the first thing developed in the womb,
Yeah.
the nervous system.
Yeah.
And so it's just been a really eye-opening journey to get to come here and actually learn and not just, be pushed through a mill of doctors. I just kind of wanted to mention that as we're learning about all this, because it's been really interesting.
How long have you been under care now? A year, you said?
A year, yeah. I started last March. Got brought in due to a car accident. Was having nerve pain every day, headaches. I see Dr. Vin exclusively. We've built a really good rapport.
Yeah.
And I was crying for the first month of therapy. It's been life changing for me. And I underwent extensive therapy for the first 4 months, and I'm to where we're doing maintenance.
Mm-hmm.
Yeah, it's been great.
That's amazing. Thank you for sharing.
It's also the food you eat, all kinds of stuff, right? It's not just adjustments.
I'm trying. Yeah, it's easier said than done. And I'm trying to grow that influence on my kids because I have a 5-year-old boy, and toddlers, chicken nuggets, all
Yeah.
processed things.
Yeah.
We've barely gotten him to where he no longer asks for McDonald's or anything anymore. So yeah, little changes. But it's
Yes.
said than done.
Listen, that's true, but little changes. So if you're my patient, I will say it's the little changes that have a big impact over time. I am one of those people that will be like, tell me all the things to do. I'm gonna start them all tomorrow, and that just sets me up for failure. I really appreciate you sharing that, because that is life-changing. Since you were 5.
I can't even really tell you when I started at my mom.
Okay.
And she was a heavy smoker too, but I'm on the highest dose of the corticosteroid you can be on. Instead of taking it twice a day, I do take it once a day. Yeah, and I've gotten to where I'll miss doses and I don't even realize it. I'm not having the tightening of the air.
Mm-hmm.
It's been amazing. But going through this, I'm realizing that my doctor or my pediatric, she's been trying to protect on my 5-year-old since he's 2. What is that doing to his resistance to the allergen?
Yeah.
And then having a 2-month-old about to be taken in for her vaccinations, I've really been wanting to speak up about the hepatitis B, because me personally, I didn't get that till I was 12. And so
Yeah, the schedule's changed.
To where you can't enter public schools without those type of things. And so
Yeah.
it's a journey.
It is a journey. Thank you for that. And that's beautiful. That's a beautiful testimony about how chiropractic, she's making all these other 5 essential changes over time. Chiropractic had that immediate change, removing interference between the brain and the body. In a little bit, we're going to start talking about mind-body connection and how important it is, and chiropractic is what helps with that. Vagus nerve is it's your vertebrae, your spine houses your spinal cord, which is your central nervous system. It's that mind-body connection. And in her case, there was an interference there since she was a small kid. Her bucket was being dumped with dirty water. And actually, I'm glad you brought this up, because it's never too late to start cleaning up the water in our buckets. It's never too late. I worked in the medical field for a very long time. I was medical minded. I actually thought anti-vaxxers were cuckoo. And I'm not proud of saying that. I'm just saying, once you start learning, and even in the medical field, I knew something was wrong. Because we would have conversations with patients. They would say, why are we all on blood pressure medications and all on the same one? And yes, it's how our medical doctors are trained. It's money for the pharmaceutical companies, but we need to start looking at the individual. That's why we're different, and that's why I love what we do here. So, not to get off track, the most common autoimmune issues. So, we've gone through allergies, food sensitivities, food allergies, and over time, this is the possibility of what this turns into. 15% of the US population is diagnosed with an autoimmune disease. And in the last 15 years, autoimmune disease rates have risen drastically, and they continue to do so. And why? Why is that? Because our immune systems are compromised from all the things. Now, this is when Treg cells are not operating efficiently and the body attacks itself. That's what an autoimmune disease is. Our T regulatory cells are not developed well, or they're not operating well, and the body starts to attack itself because it sees it as bad. Stress, processed food, lack of fresh air, leaky gut, multiple courses of antibiotics, not allowing fevers to do their job, Tylenol, medication after medication after medication, and this is the deeper level in which allergens are seen as dangerous by the immune system, or our own tissues see it as dangerous. We have type 1 diabetes, multiple sclerosis, which is what MS is, rheumatoid arthritis, lupus, inflammatory bowel disease, psoriasis, myasthenia gravis, Hashimoto's and Graves are all due. All of them are due to T cell regulation and suppression. In adults, our T regulatory cells move to the gut from the thymic gland. So they don't live here anymore, they're here. What happens when we're not taking care of our gut? Those Treg cells are not working. So leaky gut can cause it's called extraintestinal autoimmune disease. If we have a leaky gut, the Treg cells will not function and will drive a type of T cell, the T helper 2 cell, which is the one that starts activating everything. There's no Treg cells to downplay the immune system, and so autoimmune issues pop up. Okay, so let's talk about the gut. Let's talk about the gut allergy connection, okay? There's a protein called zonulin. It's a leaky gut molecule. It's a regulatory protein that plays a key role in modulating the permeability of the gut lining, okay? So it is elevated in cases of leaky gut and can be tested in blood for detection of leaky gut. The triggers are gluten, bacterial overgrowth, stress, and chronic infections. This triggers an immune response and inflammation, setting a stage for all the things we've been talking about. The test is called anti-gliadin antibodies, if you're interested. But basically, our gut has a barrier. The mast cells are there. It's tightly junctioned. It opens up for certain molecules, but should close up again. And that molecules are supposed to help us. It's like the nutrients that come through here. When zonulin is increased, our gut barrier is just open in our small intestines. It's just not, it's letting everything through, whether it's good or bad. Okay? So, and this comes from stress, meds, bad food, bad triggers, being too sterile, et cetera, et cetera. Now, when we get into what can trigger or exacerbate leaky gut, gluten is the biggest trigger in the environment for our leaky guts, okay? So in cases of Hashimoto's, 80% being women diagnosed with Hashimoto's, which is thyroid, doctors are finding that the majority of them have a gluten sensitivity. If a blood panel comes back positive and they remove the gluten, their TPO antibodies, which is a thyroid peroxidase, have been shown to almost immediately drop, because that's the antibody that's attacking, right? Immediately drop and the thyroid function improves. So imagine the relief that a person with Hashimoto's, if they have a gluten sensitivity, that could bring to them. And that's just working on the gut, okay? Non-celiac gluten sensitivity is a reaction of gluten. Is confirmed that it is highly due to leaky gut. However, the fact that grains are highly sprayed in poison is another reason for leaky gut. So that's the issue with with gluten, is it's all sprayed. And if we're eating that is causing our leaky gut. It might not be the gluten itself. And that's why we become gluten sensitive. Multiple sclerosis. Adults with MS relapsing I'm sorry, I'm starting to sound really snotty right now. Relapsing or progressive forms show increase in zonulin levels. Studies indicate a link between casein sensitivity and MS. Okay, does anybody know what casein is?
Something they put in milk and stuff.
It's a protein in the dairy food. So if you or somebody you know that has MS, and they should see if they have a casein sensitivity. The reason that is because casein and myelin is the stuff that coats our nerves. Our nerves that run through our body have a sheath, okay? And it's myelin. Our immune system has a 70 to 80% recognition, meaning it's not 100%. So I'm the immune system and you're myelin, and you have MS and you have a sensitivity to dairy or casein. I am recognizing that myelin as casein because the casein and the myelin have similar structures. Does that make sense to everybody? This is big. So if someone has MS and they have a casein sensitivity, taking that out will help preserve their myelin from being attacked on a higher level than it already is. Because MS, that's what that is. Our body is attacking that myelin sheath, the covering to our nerves. Yes, and then the uncontrollable. So that will decrease the progression of MS. So it's just phenomenal how the gut can affect all these different avenues and how it's not the first thing that's gone after with our bodies and with the symptoms that progress from there.
Did I hear you say that you performed the zonulin test? You all do that?
We do not. We do not. No, I was just recommend, or I was labeling the test that can be done at a medical doctor's office. Gut, allergies, food sensitivities, all deeply connected. Our gut helps promote immune tolerance. Leaky gut leads to overactive everything. Okay, it can lead to eczema, asthma, autoimmune disorders, sinus congestion, hives, and all roads lead to gut repair. Food is God's medicine. Food is a healer, or it can be. Good food, right?
Not the stuff on the grocery shelf.
Only stuff in the perimeter of that, and then even then you got to be careful. Because everything's being greenwashed these days. So it's just becoming harder and harder to determine what's truly healthy for you and what's not. But just don't give up. It's a journey. It's the more we learn, the more we can apply in our life. Okay. So here's where gut healing comes into place. Take things off the table that lead to leaky gut, which is the elimination diet. Basically, biggest inflammatory foods, if you are sensitive to these, is gluten, corn, soy, and eggs. If you start eating whole foods, that's going to take out the soy and the gluten. But if you eat whole foods, meaning proteins, veggies, fruit, good carbs, then you're still having issues after 6 months. I'm going to be honest with you. It's going to take a long time to heal guts. I've been healing my gut forever. And then say you heal your gut and you're in a good place, it never stops, all right? There's times where you have holidays and you eat cake and stuff. You'll need to go back into that. But these are the biggest inflammatory foods. You need to give it a good 6 weeks if eliminating due to the IgG reaction. Remember, IgG is in the gut. Now, say you have a sensitivity to gluten and you stop it. You want to give that gluten 6 weeks to stop causing and affecting your body. The IgG reaction takes 4 to 6 weeks for it to metabolize out of your system. Okay? So if you stop gluten exposure one day and you'll still have antibodies rolling around in your system in some significant fashion 3 weeks later. It is recommended 6 weeks to truly see a difference in that change in your gut. The biggest things that people notice right away, though, is decrease in brain fog, insomnia decrease, and joint pain to go away. Okay. Fermented foods help feed the good bacteria in the gut and promote healing. Now, the caveat to this is if you have IBS, irritable bowel syndrome, or irritable bowel IBD, people who eat fermented foods will feel like there's a bomb going off in their gut because there's that bacteria feeds off of fermented food and will start to have you swell or bloat and go into abnormal stools. Okay, so overgrowth of bacteria and fungus in the gut is well, let me back up. People with IBS and IBD who eat fermented foods can feel like that bomb went off because there are, as well as SIBO, small intestine bacterial overgrowth or small intestine fungal overgrowth are at the core of bacteria or fungus in the gut, which eat fermented foods and nutrients. So adding to those foods is a recipe for massive amounts of discomfort and bowel movement issues. The thing to do in this case is to eat cooked veggies, not raw, okay? And focus entirely on postbiotic supplement such as butyrate or tributyrin.
What that is?
The bottom two, yeah.
Uterine or what do you call them?
Those are postbiotics.
Postbiotics.
So not prebiotics, it's a postbiotic to help with your bowel in cases of SIBO, small intestine bacterial overgrowth. All right, so here's the steps to heal the gut, okay? Again, gut healing is not overnight. People need 3 to 6 months for that deep results, and that is eliminate irritants. The goal is to reduce gut inflammation by getting rid of harmful things. So gluten, dairy, processed sugar, alcohol, artificial additives, processed foods. Cut out disruptors like ibuprofen if possible. Non-steroid anti-inflammatory medications is what NSAID stands for. Eliminate infections if present, like yeast, bacterial overgrowth with herbs or medications. And then you want to support your digestion. So really, if you eat a whole food diet, that step 1 is going to happen, okay? Oops, did I bounce over? And then step 2 is supporting your digestion to provide your gut what needs to be done is properly digest food, which is digestive enzymes. Has anybody taken digestive enzymes? Yeah, a few of you have, yeah. This is what helps break down food and ease the burden on the gut at first. You don't want to stay on them over time. Ancient nutrition has good digestive enzymes. I'm sure there's plenty out there. And then step 3 is to re-inoculate and rebuild healthy flora. So probiotics, unless you have SIBO. Start with a multi-strain, high-quality probiotic. Gradually add fermented foods if tolerated, like sauerkraut, coconut, yogurt, kefir. Yogurt, you just want it to be very organic and not added sugar. Probiotics are fibers such as cooked and peeled or cooled potatoes, green bananas, onions, garlic, leeks, and asparagus. And then you want to go slow, especially if you have reactions, and then to repair it. Close up the leaky gut and strengthen the gut barrier. These right here, L-glutamine, zinc, collagen peptides, aloe vera juice, slippery elm marshmallow root. This is diglycerhyzinated licorice. Those are all herbal gut soothers, okay? So this is all to help with the gut to repair the gut lining. And then this is just a little table to help break that all down for you. A little easier on the eyes there. The DGLs are the licorice root extract, the marshmallow root. Those help with mucosal lining. They have anti-inflammatory properties and they help heal the leaky gut, which is also good for gastritis, acid reflux, and ulcers. Okay, so those are all really good for all of that. So that's how to heal the gut. The other very, very important aspect here is the mental health aspect, the mental health and allergy connection. It's important because it matters. You can do a lot of good. You can exercise, you can eat good, but if your mind is not in a healthy state most of the time, it's going to wreak havoc on your system. It wreaks havoc on your immune system. Okay? And mental health affects how we function as a whole human. It starts in the brain. As it pertains to autoimmune allergy manifestations, is impacting and plays a powerful and at times unrecognizable role in development of autoimmune diseases. It does so by dysregulating the nervous system, activating chronic stress pathways, and disrupting immune tolerance. Okay? Now, childhood trauma has in the research that I did, childhood trauma is associated with significantly higher rates of lupus, rheumatoid arthritis, multiple sclerosis, and Hashimoto's thyroiditis. Okay? Because this impact of stress that is not dealt with over time causes havoc on the immune system, causing autoimmune issues. Chronic activation of stress-responsive nervous system, dysregulation, gut barrier breakdown, and loss of self-tolerance all plays into what is going on from a trauma perspective. Trauma doesn't just affect the mind, it programs the immune system. Without healing the body may remain a cycle of inflammation, hypervigilance, and misdirected. So trauma equals chronic stress in our body, and our body is stuck in a fight or flight, or it goes there quite often. And this keeps our adrenals at a heightened state, resulting in elevated cortisol levels at first, but then become dysregulated and depleted. So stress, cortisol, dysregulated, depleted cortisol leads to immune confusion because our bodies are not able to regulate the inflammation response. Trauma often causes our autonomic nervous system to stay in fight or flight or freeze mode. So that's the other mode of our sympathetic. It impairs the vagal tone, which I heard someone talk about earlier. The vagal tone is the calming, rest, and digest branch. It's a big nerve that runs along from our brainstem to our gut. And it has everything to do with our calming, rest branch and digest. It reducing anti-inflammatory signals over time, pro-inflammatory state become the new baseline. So our vagal tone is down, our inflammatory state is where we live. Autoimmune issues, bad mental health. Of course, because in this state we are stuck in fight or flight, the digestive health is compromised, leading to the leaky gut. And then we have the loss of self-tolerance. Trauma disrupts learning, especially in childhood. The result is the body begins to misidentify its own tissues as a threat, which is hallmark for autoimmunity. So there's a slew of things that can be done for mind-body connection. These are the three things that I like that you can do on your own. Of course, there's therapy, there's herbs, there's lots of things. There's saunas, but these are really good. So who's done Wim Hof breathing? Wim Hof. Wim Hof. Okay, it's a type of breathing exercise. He will sometimes combine it with cold plunges, but I just do the breathing part. It is a proven method of increased, where when you do it, it increases energy, improves sleep, reduces stress, enhances focus, and a stronger immune system. It potentially offers benefits like increased sports performance, faster muscle recovery. A lot of sports enthusiasts use it, but it will unlock trauma over time. So if you're consistent with it, you'll notice like you might break down crying, or you notice your body starts releasing trauma. Yeah, yeah.
So why is it specified as the one you, I didn't understand what you call it?
Wim Hof. It's just my personal favorite breath work. There's a lot of different types of breath work out there that you can do, but breath is really good for immune system regulation, nervous system regulation, and so Wim Hof is my preferred kind of that I do. Can you demonstrate? Maybe some other time. It's about 20 minutes, and I might start crying. Who knows? Because it releases a lot. It releases a lot. Like if you've been in a huge amount of stress, Emotional release is just part of regulating the nervous system. I do have a link that I will send to my patients sometimes if they need to work on it. So if anybody wants that, let me know and I'll send it to you. It's the same one that I use at home. It's on YouTube, but I'll send you that link. Very good breathing work. Meditation. Meditation calms the monkey brain, okay, and brings awareness to the inner state. So the monkey brain is the part of our brain that's chaotic. It's always thinking, it's always anxious, it's not present, and it's all over the place, okay? Meditation lowers inflammation and stress and allows for that monkey brain to quiet down, okay? Meditation, I want to be clear, because my thought when people used to be like, Sarah, you just need to meditate, my thought was like, I need to sit there with my legs crossed and my hands on my knees and breathe and do the Om, which that's good. It just was very hard for me to do. So meditation is pretty much anything that quiets the monkey brain, allows you to calm down. So it could be coloring, it could be taking a walk, it could be knitting, it could be baking, cooking, journaling. Any of that is a meditation, okay? That helps you just to numb out. Not watching TV though, that's not meditation. And then journaling. Journaling helps move emotions that are stuck in our body in the limbic system to the rational brain, okay? So it helps us move it from promoting emotion and stress and all the bad things that we feel and moves it to our rational brain. It can shift internal patterns as you're writing it down, okay? There was an article in the journal American Medical Association that did a randomized study on the effects of writing about stressful experiences on symptom reduction in patients with asthma and RA and rheumatoid arthritis. And the results were pretty freaking cool. Here's the results. Can you guys? Okay. So this is another study that I got really excited about, okay? So and the context of this study was that it's non-pharmacological with little patient costs. The risks are useful supplements to pharmacotherapy in the treatment of patients with chronic illness. So they did it on people who had asthma and rheumatoid arthritis. They wanted to see if writing about stressful experiences affected their disease status, how it would change what they're dealing with as far as their interaction in their body with the disease. The volunteer sample was 112 patients. They had a combination of asthma and RA patients. And the intervention was patients were assigned to write either about the most stressful event of their lives or about emotionally neutral topics, okay? Now, here's the main outcome measures. Asthma patients were evaluated with spirometry, the breathing, and rheumatoid arthritis patients were clinically examined by a rheumatologist. Assessments were conducted at baseline, at 2 weeks, 2 months, and 4 months after writing were done, blind to the experimental condition. The results of evaluable patients 4 months after treatment. Asthma patients in the experimental group showed improvements in lung function. RA patients showed improvements in overall disease activity. So both of them saw clinical results. And when anybody in a research article says clinical results in a good way, it's very good. It shows that it's actually clinical. So clinical is a diagnosis, clinical is a treatment. This result was clinical. So it should impress upon all the providers. Conclusion is patients with mild to moderately severe asthma or rheumatoid arthritis who wrote about stressful life experiences had clinically relevant changes in health status at 4 months compared with those in the control group. These gains were beyond those attributes to the standard medical care that they were receiving. It remains unknown whether these health improvements will persist beyond 4 months, because they didn't test them after 4 months, or whether this exercise will prove effective with other diseases. Fair statement. But the fact that they had these results is very phenomenal. A growing amount of literature, according to this article, suggests that addressing a patient's psychological needs produces both psychological and physical health benefits. Expressive writing is one such technique that has been used successfully in several controlled studies. Isn't that cool? So, mind-body connection, gut, healing, and now these are just some things that I wanted to give you that are nutrition for the allergy relief. So just like in the past week with what I experienced with my allergies, I did all of this and it's really calmed everything down within just 3 or 4 days. Now, I had a couple bad days. I even didn't work on Thursday because I had a temperature and my voice was gone. But these here, when you're on your journey of healing, these are the vitamins and supplements that will immediately help you with allergy symptoms as you're in it. Yes, ma'am.
Why do doctors tell you not to take probiotics? That's what my doctor told me not to do.
What's the context, like as it pertains overall in general?
He's an idiot. Because if you've got something going on in your gut, it's throwing out into your bloodstream.
Okay, so people with extreme gut issues like small intestine, bacterial overgrowth, or yeast overgrowth, they should not take probiotics. I'm not sure what your condition is. Yeah, they shouldn't take probiotics because it's going to blow it up. Yeah, you should take postbiotic to help with that. But in those cases, that's when someone would be told not to take a probiotic. Yes, ma'am. Good question.
What's a prebiotic?
Prebiotic is, okay, great question. Prebiotic is the nutrients that feeds your gut micro. I'm sorry, that feeds it. Postbiotic, no, do I have that switched around? Probiotic, the gut microbiome feed on the probiotic. Postbiotic helps nurture that environment in which it is to feed on, I believe. That's the difference. So they do have two different jobs. Now, I said it earlier, but food is God's medicine and plays a huge role in allergy relief both by calming the immune system and reducing inflammation that worsens with allergy symptoms. So this is a breakdown of all the foods here. Now, we're about to close out, but I want to share a story about this girl right here. And this is a prime example of someone who starts with one symptom, goes to the doctors, and her journey from there because she's not getting answers. Now, this girl, her name is Dr. Catherine Sullivan, PhD. I'll read it in the story in a minute, but she got a PhD because of what she had to go through. Her story's on TikTok. So TikTok has some good uses, okay? My algorithm is all towards this type of stuff, not the trashy stuff on there. But she's on TikTok, and she's delivering her story through TikTok, so you can look her up. But this is her story. I'm going to read it to you, okay? She was 16 years old, okay? And she was diagnosed with mono. She got mono, I think she said, from kissing a boy. I don't know. That's a classic way, supposedly, to get it. So she was diagnosed with mono. She was told that she would feel fine in just a few weeks. Those weeks turned into months. And what she experienced over those next few months was mono flares, is how she would describe them. But when she went to the doctors and told them what she was feeling, that she thinks it's flares of the mono, she was told that that wasn't possible to have flares of mono. 1 year after she was diagnosed with mono, she was diagnosed with sinus polyps. So she continued to have symptoms. She went to the doctors repeatedly. Finally, they diagnosed her with sinus polyps, and she was heavily treated with antibiotics. She finally got the polyps removed and was told that that was why she was feeling so tired. So now she's a senior in high school. Her face started swelling up at times. She was missing a lot of school. due to how terrible she felt. Specialists told her she was healthy, her labs were normal, and that she probably had anxiety, and that she may be needing an antidepressant, but she kept getting worse. 2 years after mono diagnosis, she started getting staph infection, abscesses on her skin. So staph infections on her skin, folliculitis, which is literally like inflammation of your hair follicles. So her medical doctor put her on birth control and doxycycline. Antibiotics would seem to make her problems worse. Now she's in college. She has extreme fatigue. She sleeps through the day. Plus, she sleeps about 15 plus hours a night. This is when she started losing hope and things got very dark for her. She was being consistently failed by the medical system. She was still being told nothing was medically wrong and that she felt like she was going crazy. Her symptoms progressed into painless bruising, losing tons of hair, and low-grade fevers. Finally, doctors took her symptoms to be more than anxiety. She spent the first year of college in and out of the ER, going to the Mayo Clinic and Northwestern, and was told again that nothing was wrong. After 5 years, she was diagnosed with Hashimoto's. And she found out that Epstein-Barr virus, which is the monovirus, is linked to thyroid issues. None of her docs ever checked her thyroid. She started thyroid medications and was told she would gain her energy back and mono flares would go away. But that didn't happen. Her eyes would periodically swell shut, and by this time she was in her 20s. After undergrad, she went to get her doctorate in immunology to study autoimmune disease. So this is what she thought she needed to do to get answers, is get her PhD. Good for her. That's freaking amazing. Yes. In her first year of PhD, a titer was dangerously high, so a protein in her blood, and she found a rheumatologist that would listen. Her skin symptoms got worse with pustules, and her biopsy came back with connective tissue disorder and mild lupus. So this girl's had a slew of diagnoses already. And this is when she finally decided to change her lifestyle. After 8 years, she finally got good blood tests that confirmed chronic EBV, which is known to trigger developing certain autoimmune issues. After 10 years in lifestyle change, meaning she cleaned up her food, she talks about it. She cleaned up her food. And she probably worked on her mental health because 10 years of this really took a toll on her. 90% of her Hashimoto's lupus symptoms are gone. She's weaning off thyroid meds, and her ANA is barely positive, which is that titer that they saw. And she's finally feeling normal. This is, unfortunately, not everybody's this drastic or severe, but it's a classic thing that we hear constantly, especially here in the clinic, is like, we're usually the last stop. We're usually the last stop for people who are looking for answers, and they've already gone through a slew of no answers. And the amount of times we hear, I'm not crazy. Am I? No, you're not. You live in your body. What you're feeling is real. So this is a classic case of how something starts minor, and that bucket is just being turned into an autoimmune condition. And then she got a PhD and healed herself. But that is, I really love her story. I love that she's sharing it, and a lot of people relate to it. So the gut is key here. Now, I mentioned all the supplements I want to offer to you guys today. There is a new supplement we have here that takes everything that I've talked about as far as inflammation, immune system, digestion, detox in your gut. And this is the newest supplement we have here. We have never had this here before. It's brand new. It's the most comprehensive and synergistic supplement bundle ever created to support human performance. This stuff is raised on a regenerative farm. It is sourced pure and has amazing ingredients. So those of you that are on the Daily Essentials, you could take this bundle right here is to take the place of that. But today I'm talking about 2 of the bundle because that's what is directly related to our immune system. So The unique ingredients in here is 20 clinically studied ingredients in their clinical studies, multiple bacterial ingredients, which are good for the gut, multiple animal ingredients, grass-fed organs, which is the more research that's coming out is what we're missing in our diet, which does not excite me at all. But if you think about the wild, what do the wild animals, the meat eaters, the carnivores, what do they eat first? Is they eat the guts, they eat the organs. Liver supports liver, kidney supports kidney. So we have really good, well-sourced beef organs in these supplements. So the first one is inflammation and immune support. It's comprehensive support for balanced immune system and healthy inflammation management through the body.
Do you have anything for alpha-gal people?
For what? I'm sorry?
Alpha-gal people?
Did you say alpha-gal? What is that?
I was bitten by a tick and I think had no meat product or product in their alpha or their animals.
I would have to find out for you and get back to you on that. You're talking about as far as these supplements go here? Yeah, I'll have to find out for you if they have anything like that. It's a good question. Please tell me afterwards so I can write it down because I will find out for you. Inflammation and immunity is the first one that is a very good supplement to take for your joints. It's 6 clinically studied ingredients, hydrolyzed eggshell membrane, which is collagen, supports our inflammatory process or response, tendons, the skin, our beauty resilience, they threw that in there. Boswellia helps with inflammation in the gut. So all this that is in these supplements is very bioavailable in your body. You're going to absorb all of it. You're not going to pee it out. Vitamin A, vitamin D, vitamin K for your vitamin D absorption. And then we have the digestion and detox for the gut healing. So this one has anti-SIBO, so it helps with the small intestine bacterial overgrowth. It has a glyphosate shield to protect your body from all that trash that they're spraying on our food. I like that it has glutathione. The SOD here that you see at the third bullet, that is super antioxidant that helps cells' first line of defense against damage from oxidative stress. SOD neutralizes free radicals, which are damaging to our cells, and it converts them to water and oxygen, which is not damaging to our cells. Isn't that crazy? So all of this, like the Claseus is a powerful probiotic, coagulins are probiotic. So lots of the Saccharomyces boulardii, which is on the last PowerPoint, that is for probiotic from yeast. So all of this is very, very good for the gut and the gut healing. So if you are on a journey of gut healing, I always hesitate to put supplements in my talks because you can't supplement yourself to health. But if you're in a journey of healing your gut and getting your immune system and your gut to balance out, this is definitely going to help you in that journey. Okay, so if you guys are interested, this bundle, I put it on the first slide, I think. Oh, it's 25% off today only. Okay, these are what for the two. It's usually $129.98, but today only is $97.50 if it's something you guys are interested in taking. Okay, so that's it for this presentation. Does anybody have any questions for me? Thank you, Deborah. Thank you. Yes, ma'am.
I'll talk to you privately.
Oh, okay. Yes, ma'am.